Hello and welcome to Tampa Bay Right Now, where we inform you, the community, on issues affecting the area today. On this show, we're highlighting a few local organizations that support those affected with autism. We will provide information on these organizations and let you know how you can help make a difference with them. This is Tampa Bay Right Now. Hi, I'm Allison Burns, and around the country, autism is the fastest growing developmental disorder, but you may not know that. Awareness of autism is a main focus of local organizations, and here today to give us more information on the disorder is Dr. Flora Howie from the Autism Center at the All Children's Hospital. Welcome to the show, Dr. Howie.
Thank you, Allison.
So tell me about your role, first of all, with this organization.
I'm the medical director of the Autism Center. We're in St. Petersburg.
Okay.
At All Children's Hospital, Johns Hopkins Medicine. And we opened May 1st last year.
Oh, so it's new.
Yes.
That's
yes.
fantastic. So tell us about autism. Let's get right into it. What is this?
Autism is a neurodevelopmental disorder, genetic pattern of inheritance. What that means is it affects the brain, it affects development, and it can be, we believe it is inherited.
Okay.
However, there are these unknown environmental factors, as yet unknown, that may cause a child to express autism.
And I know that this is pretty new as far as people are starting to talk about it more, people are writing books about it more. There's a lot of studies out there saying, like you said, diet can affect how things are going. What would you say to people who have questions about this? Where can they go to find out more?
Oh, there are lots of resources online. The American Academy of Pediatrics is an excellent resource. Autism Speaks has a wonderful internet website that families can go to. There are, through the CDC, the Center for Child Development, the Center for Disease Control, rather, there is information. As the studies that we have done, looking at things like manipulating diet, hyperbaric oxygen chambers, things of that nature, we do not have controlled studies that are showing us that it makes a difference. So if you take a population with, without, no one knows what the other's getting, double-blinded, and you try and determine, can we make a difference, we're not finding that.
Right.
There are a lot of unknowns still.
Yeah, and that's unfortunate for a lot of parents. I know sometimes they feel lost. They don't know,
Exactly.
you know, where to turn, what to do. How many children are being affected by this?
Well, in Florida, we have a 2012 estimate based on the most recent census, about 4 million kids in Florida. The prevalence is 1 in 88.
Wow.
And what's even scarier, if you look at boys, it's 1 in 54, girls 1 in 252. So it's more prevalent in boys.
Sure.
So in our Tampa Bay area, we're looking at about 46,000 kids.
Yeah, and are there different levels to autism?
Yes.
Because I know, and it's different than like ADHD, correct? There's different, you know, I know a lot of people just kind of throw these terms out there, but autism actually has different levels, or they use, I know it's what, the spectrum?
Absolutely.
Can you talk a little bit about that?
Sure. You have children who are on the mild end, and often we use terms like Asperger's syndrome or high-functioning autism. You have children that have more severe symptoms, where they have more classic symptoms of autism. There are some core defining features of autism. One is difficulty with socialization, another difficulty with communication, and we have something we call the RRBs, restricted repetitive behaviors. So you can have repetitive behaviors in speech, in how you use objects, maybe taking a stick and just shaking it repetitively as something that a child might find entertaining or fascinating. You can have difficulty with that back and forth socialization, a give and take conversation, reading social cues. So the way you're making eye contact with me, nodding your head, that may be something that a child with autism has to learn that comes naturally to us.
And is it sometimes confused with other things? Is there times when kids maybe just have, I know, OCD, or maybe they're just a little slower, kind of involving themselves in social situations, is it hard to determine, or is it something that eventually it's very clear?
It can be very clear, but the process of going to get to that point of making the diagnosis can be pretty complex. We have a team at the Autism Center. We have myself, developmental pediatrician, nurse practitioner, physical therapist, speech therapist, behavior analyst, psychometrists, occupational therapists, an RN. We have a whole team of people. And when we do evaluations, everyone is involved. And we use a number of tools that it does require an amount of training to use and expertise. And that will get us to the diagnosis.
And what ages do children normally start being diagnosed? Is it very early in their life, or is it later?
We've seen children 12 months old. We now have a toddler module for something called the Autism Diagnostic Observation Schedule, where we can look at it at that young age. But most of the tools, it's starting at about 18 months of age when you can really make a diagnosis.
Okay. And so at the Autism Center, what are you guys doing to help families, to help children?
We, when a family calls in, they kind of knock on the door of the hospital. We start an intake process, and we gather information. We alert families, hey, if you have any records, any past things, bring them with you. We find out what their main concerns are, and then we schedule an appointment for a visit. And when they come in for the first visit, they meet the team face-to-face, and we go through the evaluation process. It may take 2 visits. Then we have a post-visit where we review the information that we've gathered. We go over it with the family, and we kind of have a roadmap in the form of a report that we're reviewing with them as to what we think is going on with their child and what is needed.
So you're there from the very beginning, and you take them all the way through the process.
Yes.
Well, thank you. Well, thank you very much for being here and for sharing the information that you have.
My pleasure.
Now, don't go anywhere. We will be right back with a representative from our local Walk Now for Autism Speaks.